Welcome to the New England Journal of Medicine at the annual meeting of the European Society of Cardiology. I'm Stephen Morrissey, Executive Managing Editor, and I'm talking with Deputy Editor Jane Leopold and Editor-in-Chief Eric Rubin. We're looking at the Senior Rita trial, Invasive versus Conservative Strategy for Older Patients with Myocardial Infarction. Jane, this is the first of the Sunday studies we'll be discussing. What's this one about?
So this is a study that's looking at how best to manage elderly patients who have non-ST segment elevation myocardial infarction. And what they're asking is whether or not these patients should have a conservative approach of medical therapy and revascularization only if absolutely warranted, or should they be treated with cardiac catheterization and PCI up front.
And Eric, how did they approach the question and what did they find?
Steve, they randomized those with an NSTEMI who were 75 years or older, and these patients were all in the United Kingdom, to either coronary angiography and revascularization plus best medical therapy or medical therapy alone. The primary outcome was the time to cardiovascular death or non-fatal MI. The investigators enrolled more than 1,500 patients. The primary outcome occurred in more than 25% of patients in the invasive group, and a similar number, just a little over 26%, in the conservative group during a median of 4.1 years. This difference was not significant, suggesting no advantage to invasive therapy.
Jane, what was unique about the patient population in this study?
This study was really the first to actually include what we would almost think of as all comers. So they included elderly patients who were considered frail, and they measured frailty using several frailty scales that are validated. And they also enrolled patients with a lot of comorbidities, which is typically what we see in elderly patients. In many trials, these patients are excluded, so we never really know what to do with them, and yet these are the patients that we see every day.
Jane, I've got an important question for you. Your cardiology colleagues are great at coming up with names of trials, but Senior Rita is particularly good. Is this your favorite of the ones that we're publishing?
Oh, it's up there.
Jane, as an interventionalist, you're a believer. You think that these procedures can be beneficial. So are there still older patients who you think should be undergoing revascularization?
I do think there are some older patients where revascularization and revascularization up front is warranted. We have looked at this question before, but we haven't looked at it in the population of patients who are both frail and have a lot of comorbidities. So not every elderly patient is the same. And I think this is where having data in this space from Senior Rita will really help us with decision-making.
Thank you, Jane, and thank you, Eric. This study was just published at NEJM.org.